Today, I'm going to tell you the story of some of this work that I've been doing, as Dr. Martyr said, supported by ISP, and it's been several years in the making. And I wanted to start by sharing with you the story of Mr. Kermit Smith, written by him in his words. So he stated, "I liken living with Parkinson's to residing with an unwelcome guest. I made it quite clear, even unashamedly rude at times, that he was not wanted. Go away, leave me alone. I was always emphatic, and on occasion even screaming, I don't like or want you. But nevertheless, the guest ignored my imploring and decided to make my home and my body his home. Mr. Parkinson's disease moved in as if I were a long-time vacation resident, because with every year that went by, he became more comfortable residing in my once happy abode. He paid no rent, offered no entertainment, nor did he amuse or comfort me. He did follow me to football practice, sat with me while I watched basketball games, and accompanied me to the theater or movies, but never once did he make me laugh or bring me joy. Some friend he is. No, I never received any benefits from his extended stay in my home. Yes, I regard Mr. Parkinson's disease as an opportunistic, unsought guest who took advantage of me when I was experiencing a very low ebb in my life. I was the primary caregiver for my mother and even moved into her home to better address her health and spiritual needs. I happily settled into a routine with her, and she became one of the primary foci in my life. Sadly, in July of 2014, she took her place among the ancestors, and I was devastated, lost, even clinically depressed. In 2015, I retired after 41 years of continued employment, and though I was elated to retire, it was another dramatic and disruptive force in my daily routine. Life was different, so very different that I barely recognized my once lively, invigorating self, and then in walks my unwelcomed guest. With his arrival, I began to notice that my gait was off, my mental acuity was fogged, stiffness robbed me of my strength and fatigue. I sought the help and guidance of my primary care physician. He sent me to a neurologist. One fateful day, I heard him say, "Mr. Smith, I think you're in the initial stages of Parkinson's disease." Me, Parkinson's disease? I thought that Parkinson's was a disease of prize fighters or football players, or those who had suffered multiple concussions. Since I fit none of these categories, I needed to believe that the neurologist was mistaken. My undesired guest was extending his stay, and everyday life became more challenging in all spheres, emotionally, physically, and spiritually. I grew increasingly frustrated, but over the years, I accepted the complexities of my new life, and I realized that I was the new and updated version of Job of the Old Testament. God, as he had done with Job, told Satan to do whatever he desired with me, but don't take my life. Parkinson's, like Satan, or perhaps better, the unknown, is cunning. Mentally, it made me doubt myself. Physically, it played havoc with my body, and spiritually, it caused me to question my faith in God. In the end, God revealed to me that Mr. Parkinson's could not inhabit my body or my home without me and God having a say in the parameters of his stay. Daily, I discovered ways to make my guest less comfortable and me more at ease with his presence. My guest detested that I was introduced to a wonderful and competent neurologist. She considers me a partner in my care, assists in the management of my medications, and with navigating the complexities and perplexities of the healthcare system. I was also introduced to a psychiatrist who assisted in returning me to the strength of spirit to resume football coaching and traveling. The physical aspects of the disease were easy for me because I like keeping my body in good condition, and going to the gym as recommended was already my habit. Spiritually, I committed myself to God's care and praying for the knowledge of his will and for me to have the integrity of spirit to follow it. Prayer, meditation, and daily affirmations allowed me the freedom of thought to regain aspects of my life that I suspected were woefully expired and decomposed. My guest is still here. I know it and he knows it, but I've learned to thrive even in his presence, and neither of us is going anywhere. Sometimes he demands his squatter's rights, but many days I am the one who calls the shots. Once again, I traveled to Egypt, and for the first time I toured Ethiopia. I resumed my football coaching, and I'm studying Egyptian hieroglyphic writing, and Broadway theaters, which were once lost, are now my reacquired friend. I am healthy, I am strong, I am disease-free. I am blessed by my ancestors, I am blessed by God. I share this story with you as I have found it to be particularly poignant, moving, and telling of the experience of this remarkable individual who is diagnosed with Parkinson's. It is one of many stories that's told in PD Movers, We Keep Moving, Living and Thriving with Parkinson's Disease in our Black and African American communities, an illustrated compilation of narratives of 10 individuals who are living with PD and care partners as well at various stages of the disease, young and old. Our goal is to inspire and connect individuals in the community by sharing the experiences of these individuals. And we also hope these stories will educate others by removing the mysteries and misconceptions of PD and provide useful resources regarding diagnosis and treatment. There are many unique aspects of Parkinson's in each individual story, which is the nature of Parkinson's, but there are also many common threads of terror and frustration with diagnosis, and the importance of community and faith, and ultimately strength and resilience. I wanted to take a moment to flip through the book for you all, just to give you a sense that it's a first-person account, which is presented and conveyed as a conversation among the Parkinson's PD movers, mirroring a conversation that happened over a series of Zoom sessions. The conversation is punctuated by educational information, for example, understanding what Parkinson's disease is and reviewing what happens in a doctor's visit, addressing some myths and facts about Parkinson's. As Mr. Smith pointed out, he thought Parkinson's only affected those with brain injury. And then reviewing how individuals cope and thrive with this, including treatment, exercise, and engagement with resources in the community, research, and healthy habits. So now I'd like to go back and tell you how this resource was developed. In terms of the inspiration and journey, as Dr. Martyr said, I was raised as an Indian immigrant and had training based in public health. Since childhood, I think, given the color of my skin, I was often an outsider in my own community. And in our home, the importance was really placed on education, family, community, and faith. With frequent visits to India, I witnessed firsthand poverty, as well as the associated health disparities. And as a result, I've always been drawn to issues of equity, and I'm acutely aware of the range of variability in healthcare, not only globally, but in our local community. During my fellowship, after being in Geneva, as Dr. Martyr said, it was hard to ignore the apparent disparities of care. My observations are echoed in the literature, where despite Parkinson's being the second most common age-related degenerative disorder, African American and Black older adults are less likely to have a timely diagnosis, less likely to receive high-quality care, which would be defined as access to a specialist or even a neurologist, medications, prescriptions, referrals to rehabilitation, and access to advanced care. Further, African American and Blacks face increased rates of disability and are underrepresented in clinical trials. So looking to address this, I was connected to Ms. Amina Parker, Outreach Director at St. Luke AME Church, who I believe is on this call, based in Harlem, using the CBPR program, which is sponsored by the Irving Institute. Ms. Parker and I had a shared interest in raising awareness of brain health. And she and her community taught me about the role of lack of trust of providers, stigma, shame, and isolation due to mental health and brain disorder, and the role these factors played in access to care, engagement with treatment, and many other issues. Acting as a trusted gatekeeper, Ms. Parker introduced me to the community she worked with, and I was able to build relationships via monthly brain health seminars that were conducted in person and later virtually during the pandemic. This was all done using the principles of CBPR and recognizing not only the historical legacy of slavery and racism, but the contemporary ramifications of these on policy and attitudes, and that mistrust of the healthcare enterprise is alive and living and requires us as providers to really acknowledge their role in the current healthcare disparities. And I also would be remiss if I didn't mention the important role of the murder of George Floyd, which happened in 2020 during this process. I think it made the experiences of the Black community difficult to ignore, but it also played a powerful role as a mobilizer and activator of students and individuals to participate in our efforts and support this work. So utilizing the CBPR methodology, which is really an approach emphasizing the importance of acknowledging power dynamics between communities and providers, recognizing the community as its own entity with its own set of skills and expertise. And I oriented toward community action, we set upon this path to try to raise awareness about brain health. We began with a series of brain health seminars, which took place over the course of a year at St. Luke AME Church, as well as senior centers in Upper Manhattan. They occurred in person and virtually, as I mentioned, in English and with Spanish translation. We then began to conduct health fairs, which happened at 2 locations. And these health fairs were developed in partnership with the church, from the messaging and the flyers to the actual implementation and operationalization of brain health screens. The following year, we had another set of health fairs, and this time included more messaging in Spanish. And we held a symposium in partnership in order to educate our providers about the role of faith-based organizations in health promotion. Finally, we began to look for a group of African-American individuals with Parkinson's disease and their caregivers to develop a tool, as Ms. Parker identified a need for having a training course for community health workers, formal and informal, with an emphasis on the Black community and individuals' journey with Parkinson's. This focus group that she helped us recruit for, the data is still being analyzed, but in preparation for that, we've conducted an extensive literature analysis. And this is a little bit of a busy slide, but I think it goes to the fact that there are many different aspects that are leading to health disparities in this community. And our next step is to then superimpose the results that we've obtained from our focus group onto this map. We held a workshop over the course of 3 days about how to live well and thrive with Parkinson's disease and ensure that it had a multidisciplinary approach. And finally, we've developed the PD Movers Storybook. And this book has been met with a high level of enthusiasm and excitement. I've heard anecdotes of individuals who've taken it home to their families and there have been tears shed where family members said, "We never knew you were affected in this way. Why didn't you share this with us before?" For the first time, some people are seeing themselves in the stories that are being shared, and it's creating connection and a sense of community for these individuals. When we first gathered the PD movers for our first Zoom conversation, everyone in the group said they had never been in a room before with someone else that was Black that had Parkinson's disease. Often they were the only person of their ethnic background in a waiting room. So I think that what we've found is that this storybook it's a unique project, it's engaging, it's opening doors and opportunities, and it really demonstrates that representation matters. Sharing these stories allows others to share their story, resulting in conversation and connection. Because of this, this is a clip of an article that came out actually just over the weekend in USA Today. They had a supplement about clinical trials where they highlighted the storybook. The work is being highlighted in various organizations and foundations that are focused on Parkinson's, including the PMD Alliance. University of Florida has featured it on an online blog. Michael J. Fox has listed it in their books and resources online. We've been invited to participate in webinars, blog posts, interviews. So we're really thrilled, but I think what's most important is to try to share what led to this project being successful and really resonating with the community and why it's generating such interest. So we utilized a faith-informed approach that's community-based to create this piece of work. It seems easy, but we really started on this journey in 2019. So it took a lot of investment of time and effort. It required us to have equal partnership. So Ms. Parker and I are now very close and connected. We communicate weekly, if not more often. And I really felt it was important for me to come to that relationship being human first, being vulnerable and honest, transparent and intentional. It was really critical that I listen and just keep listening and then internalize those comments, whether it be how to develop a flyer, what type of visual imagery to use, what type of language was appropriate. At Brain Health Talks, I would acknowledge each individual in the room and be sure to refer to them as Ms. Smith or Mr. Smith and show my respect. And I think because we continued to show up in a consistent and ongoing way, we earned slowly the trust of the individuals at the church. And with that trust came the expertise and the sharing. Some individuals in the PD Movers were not eager to share their story, or they felt they didn't have a story to tell. But I think that as we built these relationships, we were able to come up with a product that really is authentic and shares the voices of all the participants. What I think is also really unique is that this tool utilizes a first-person storytelling technique to deliver joyful, empowering, and educational messages. Rather than me as the doctor or provider trying to teach other people about Parkinson's, I think it is more powerful when it comes from an individual who's affected by the disease. And the messaging is culturally sensitive, interesting, and engaging. And it really, I think, is creating a sense of communication. Along the way, we were really sure to acknowledge the role of discrimination, stigma, isolation, and prior transgressions of the medical field and society as a whole that are leading to the health disparities that we're seeing today. And this was all in order to build trust. So what's next? We want to close the gap for Parkinson's disease care in the Black and Brown communities, and we hope to create a community of trust, joy, and empowerment to share knowledge and valuable resources, because it's all out there, but I think that it's not getting to these individuals in the way that it needs to be. We're hoping to spread the word using social media and other media strategy approaches. And our next steps include establishing a network of support for African American and Black individuals with Parkinson's, hopefully using this methodology to reach Hispanic populations and developing future versions focused on different topics, and encouraging the use of this methodology in other disorders and disciplines. We plan to, with this, continue our ongoing efforts of providing education to the community, and we hope that it can be utilized as an advocacy tool to recognize the needs of those living and thriving with Parkinson's. So I wanted to be sure to thank the wonderful collaborators at St. Luke AME, particularly Ms. Parker and the late Norma Husband, who the three of us took the class together, and unfortunately Ms. Husband passed away during the pandemic. those at the Neuro Rehab Lab, especially Danielle, Alyssa, and Michelle, who have really been instrumental in doing this work, the PD Movers, without whom we wouldn't have these powerful stories, and our other community partners, the St. John Baptist Church and Mount Nebo Church.